Welcome to Bloodborne Pathogen Training. Your certificate from this course is your OSHA Bloodborne Pathogen Certification, compliant with 29 CFR 1910.1030. So, what are bloodborne pathogens? Bloodborne pathogens are tiny, invisible germs, like viruses and bacteria, that can be found in blood and some body fluids. These germs can make people very sick if they get into someone else's body. They can cause diseases like HIV, hepatitis B, and hepatitis C. These germs are called bloodborne because they are mainly spread through contact with infected blood. This can happen if someone's infected blood gets inside your body through cuts, open wounds, or even through your eyes, nose, or mouth. They can be spread when you touch stuff that's contaminated with blood or infected fluids, and then touch your eyes, nose, or mouth. So in simple terms, bloodborne pathogens are tiny germs in blood and body fluids that can make you sick if they get into your body, and it's important to know how to protect yourself from them. What fluids can make me sick? So it's not just blood. These other body fluids can carry germs that make you sick if you touch them, or if they get into your body through open wounds, your eyes, nose, or mouth. It's important to be careful and use protection anytime you're working around blood or other body fluids. Fluids other than blood which can make you sick are called other potentially infectious material. There are many types of these germs, but here are a few. HIV, or the human immunodeficiency virus. HIV stands for human immunodeficiency virus. It weakens a person's immune system by destroying important cells that fight disease and infection. There is currently no effective cure for HIV. But with proper medical care, HIV can be controlled. Symptoms of HIV can take years to appear, so you might not notice anything right away. HBV, or the hepatitis B virus. Hepatitis B is a vaccine-preventable liver infection caused by the hepatitis B virus, or HBV. Hepatitis B is spread when blood, semen, or other body fluids from a person infected with the virus enters the body of someone who is not infected. Not all people newly infected with HBV have symptoms, but for those that do, symptoms can include fatigue, poor appetite, stomach pain, nausea, and yellow skin and eyes. Hepatitis C is a liver infection caused by the hepatitis C virus. Hepatitis C is spread through contact with blood from an infected person. People with chronic hepatitis C can often have no symptoms and don't feel sick. When symptoms appear, they're often a sign of advanced liver disease. The symptoms are the same as those for hepatitis B. There is no vaccine for hepatitis C. OSHA Standard 1910.1030. To combat these dangerous germs, OSHA created the Bloodborne Pathogen Standard. It is a federal regulation found in 29 CFR 1910.1030. The rule requires that your employer have a plan for dealing with bloodborne pathogens, keep records of anyone who is exposed, and provide you the hepatitis B vaccine and personal protective equipment for free. The biohazard symbol is a warning sign that tells people there might be dangerous germs in an area, such as those from blood or body fluids. When you see this symbol, it means you should be very careful because these germs can make people sick. This symbol is placed on bags of contaminated laundry, trash, needles, and anything else that could be infectious. It's important to use this symbol to label anything that contains blood or other potentially infectious material. How are these germs transmitted? Bloodborne pathogens can't get through our skin. It's like a protective wall, but germs can get through the wall if they get any cut or break in your skin. Germs can also get in through your eyes, nose, or mouth. Universal precautions. Universal precautions is a safety rule for everyone, whether you're taking care of someone at home or working in different jobs. It means treating everyone's blood and body fluids as if they could have germs that make you sick. Engineering controls. It's important to use safety devices such as Sharps disposal containers to protect yourself from potentially infectious material. Sharps disposal containers are strong containers made from puncture-proof material to protect you from sharp objects like needles and broken glass. These are known as engineering controls. Administrative controls. If you come into contact with potentially infectious body fluids like blood, it is super important to follow safety rules, like washing your hands after removing your gloves. These are known as administrative controls. PPE, or personal protective equipment. If you're coming into contact with blood or other potentially infectious fluids, it's vital to use personal protective equipment to protect yourself. This is the last line of defense to protect you. Personal protective equipment usually means safety glasses, gloves, masks, and/or gowns if you're dealing with large amounts of fluids. Make sure to select any PPE you need to wear to prevent you from touching blood or other body fluids. Vaccine. The hepatitis B vaccine is a shot that helps prevent a serious liver infection. If you work in a job where you might come into contact with blood, your employer will give you this vaccine for free. The hepatitis B vaccine is safe and highly effective at preventing hepatitis B infection. When given in the recommended series of shots, usually 3 doses, it provides long-lasting immunity. Exposure control plan. Your employer has a document that describes how they protect you from bloodborne pathogens. It's called the Exposure Control Plan. Ask your supervisor if you want to see a copy. Exposure procedures and medical evaluation. If you ever touch blood or other potentially infectious materials, make sure to wash the area with soap and water thoroughly. If you get blood or other body fluids in your eyes, nose, or mouth, flush the area with large amounts of clean water. If you may have been exposed to bloodborne pathogens, it's important to contact your employer immediately and document what happened. Your employer is required to give you a confidential and professional medical evaluation for free. This is the end of our OSHA bloodborne pathogen training video. Once you complete the course, you will receive your OSHA bloodborne pathogen training certificate by email in a few minutes. Thank you for watching.